It is immediately evident in every aspect of patient care UCLA Health System's uncompromising commitment to infection control.
UCLA Health System's mission for infection control is zero tolerance. We want no patient to suffer an infection in the hospital that can be prevented.
Part of being a healer is not only giving patients medicine to make sure that they're getting better, but also to prevent them from having complications or infections while they're under our care here in the hospital.
Patients come to our hospitals expecting that we will care for the disease that they have and that we will not harm them. Crystal clear to everybody, not giving them an infection.
In surgery, infection control at UCLA goes far beyond scrubs, caps, gowns, gloves, and masks. Doctors often give antibiotics before surgery to fend off infection. And during surgery, infection control is always part of a comprehensive plan.
We try and do everything we can to make sure that the bacteria who normally live on the skin do not get inside the operative site.
Judy has come to UCLA from Oregon, 1,000 miles, to get her knee replaced.
We are completely finished. You have your new knee in place, and we think you're doing just great.
We're doing everything that we can here at UCLA to create a culture of safety in everything that we're doing. And many of the procedures that we've implemented here in the operating room are critically important to us to be assured that every possible attention has been paid to safety and that we can look forward to the very best possible result for our patient.
Because UCLA treats some of the most complex medical conditions, so-called bundles of best practice techniques are implemented when placing catheters, breathing tubes, or central lines that are often used to deliver medications directly into the bloodstream or for drawing blood.
Now I'm going to put on a blue sterile drapes on you.
There are checklists that have to be followed. There are clear principles that will prevent and minimize infections, such as the right kind of draping, the right kind of antiseptic preparation of the skin, and we actually incorporate checklists in the kits that are used for the insertion of those devices. We expect every practitioner to use that checklist, and in fact we track whether or not those checklists are being followed.
We've instituted total barrier protection when the lines are inserted. So it's like an operating room procedure where you cover all the surrounding area and make sure that sterility is maintained during the procedure. We have to provide very high quality care. We have to provide safe care. And safety really is the foundation of it all.
Most of us know the critical role of environmental services, the housekeeping staff, in keeping the hospital sanitary and free of disease. But UCLA uses an electronic white glove treatment, a black light that detects the smallest amount of debris, making sure every surface has been thoroughly cleaned.
We have now what we call the electronic white glove approach, where we measure the tension of the dirt or soil and the surfaces. So you're able to tell if an employee actually wiped down that surface or not, which helps us now create more awareness among the staff that yes, this table might look clean, but do we really clean it? And does that give us a reason not to clean it? No, we have to clean it every time.
At the core of infection control is a culture of safety, universally accepted practices embraced by every member of the UCLA Health System team.
Washing your hands. You know, hand washing is probably the single most important thing that anybody can do, especially us nurses, when we go into a room, before we leave a room, before we touch a patient, especially, you know, in hospital where we're taking care of babies and mommies.
And UCLA is believed to be the first in the country to establish a breakthrough safety surveillance program called MAPS, Measuring to Achieve Patient Safety. Student volunteers, mostly pre-med, public health, and nursing students, shadow UCLA doctors and nurses to make sure every infection control and safety precaution is perfectly performed.
And the volunteer shadows all different kinds of staff, in the hospital, including nurses, physicians, care partners, caregivers, respiratory technicians.
They're auditing on our hand hygiene. They audit on unattended and unlabeled syringes. They audit on 2 patient identifiers before blood is drawn and before medication is given. It's in real time, which is wonderful. Everybody here wants to make UCLA a safe place, and it shows.
The volunteers will come then and see if the nurse washes her hands for 15 seconds, and some of them will wash only for 10 seconds. People will remind you, hey, you didn't do this, or you didn't do it correctly. So it's a learning tool, it's not a blaming tool. You put this in your behavior and your behavior changes.
This is one of the reasons why the UCLA is one of the best hospitals in the United States and even the world.
I hope that the patients will enter and leave with great confidence that our focus is only upon you. We very much care about your individual safety and the quality of your experience at UCLA.